Hello, welcome to the final edition of Pin Alert, your roundup of COVID-19 developments across Africa. This edition, we will be highlighting some of the reporting we have done on the pandemic and then proposing what we believe is the outlook for Africa. Early in the year, the World Health Organization declared COVID-19 a global pandemic. Pin Africa has been following COVID-19 developments in Africa since. Here are some of the highlights over the last 6 months. In the second week of April, Africans voiced their rejection for vaccine testing in the continent, following implications by 2 French journalists that Africa should be the clinical testing ground for a virus that few understood at the time. Many across Africa joined the outcry against the proposed plans. In May, Senegal took the headlines by developing testing kits that can detect COVID-19 within 10 minutes. The kits are sold at $1 to ensure that they are widely available to the public. June saw South Africa commence its COVID-19 human vaccine trials in Johannesburg and Pretoria. Vaccines developed by the Oxford University's Jenner Institute were the first vaccines to be trialled in Africa. July highlighted different outcomes within different African regions, as Nigeria announced that it would see its COVID-19 restrictions on interstate travel within the country relaxed outside of stated curfew hours, while Algeria announced that it would reimpose travel restrictions to stop a new rise of coronavirus cases. And in August, Botswana reimposed lockdown after a rise in cases following those travelling from bordering South Africa. Later in the month, the World Health Organization's Dr. Tedros Adhanom Ghebreyesus confirmed the release of $2.5 million of emergency response funds to support the COVID-19 response throughout the continent. Like all continents, the COVID-19 pandemic has exposed the frailties of healthcare infrastructure within African countries. But the fears that Africa's health systems would collapse under the weight of the pandemic have not been realized, because the virus is behaving much differently in Africa than experts predicted. Also in late August, the WHO reported that Africa may have passed the peak of COVID-19 cases after it recorded nearly 1.2 million cases and at least 28,000 deaths since the virus arrived on February 14th. Recently, the Africa Centers for Disease Control and Prevention has reported that there has been an average 10% fall in weekly cases. Still, the virus has caused damage in some areas while offering opportunities in others. For the first time in 4 years, Ghana's economy has contracted as lockdown measures, stalled activity, and reduced oil prices have derailed the economy from its upward trend. This trend is similar in other African countries with growing economies before the pandemic. But the positive outlook of COVID-19 on the African continent is the increased scale of preventative measures. Sub-Saharan Africa went from having 2 laboratories equipped for testing to developing testing capacity in all countries by adapting labs originally focused on HIV and tuberculosis. In general, medical collaboration through the Africa Collaborative Initiative to Advance Diagnostics has seen the improvement of over 90 laboratories and improved quality standards in 34 African countries for medical products. The hope is that long after COVID-19, these changes will have a positively dramatic effect on the continent's fights against some of Africa's traditional scourges, including HIV and malaria. That's it for the final Pin Alert report on COVID-19 developments across Africa. We are Pin Africa. Thank you for tuning in over the last 6 months.